be demonstrating how to place an LMA in a neonate. So here's now we've got a neonate here less than 28 days old who's inadequately breathing, so we want to ventilate for them. So first of all, I will place the patient in a sniffing position, place a towel underneath the body, and so that the air is in line with the shoulder here, just to align the airway and open it up. I've got all my equipment here set up, got my LMA, OPA, I've got suction ready if I need it, and bag valve mask. So first we want to pre-oxygenate the patient, so we use an OPA here, and tongue compressor. So we'll compress the tongue, place an OPA, get our bag valve mask which is set to 5 centimeters of water of peak and attached to oxygen, 10 to 15 litres per minute, and ventilate the patient for 2 minutes before we consider placing our LMA. So after 2 minutes, take out the OPA, put our LMA here. We've got a size 1 LMA, which is for a patient which is less than 5 kilos. So first we want to check that the cuff inflates, so inflate the cuff, make sure that it's inflated, got no leaks in it. Yep, that's fine, and we'll deflate it to about half, just so it's easier to get into the mouth without injuring the soft palate or hard palate. So we'll lubricate LMA. We'll get our tongue compressor, tongue out the way. Place that in and we'll inflate the cuff. Now we want to check if we've got it in place correctly, so we want to check for chest rise, so we'll get the bag valve mask, attach it, check for chest rise. Yep, we've got chest rise. So then now we will secure the airway. So we've got some tape here, which I've pre-cut. Place that on there. Now we can ventilate the patient at a rate of 60 per minute. Also, if we were trying to troubleshoot the LMA, say if we weren't getting chest rise or something like that, we use the acronym DOPES. So that would be dislodged, so say if the LMA was dislodged, or if we had an airway obstruction, something like a pneumothorax, we could rule it out by listening to the chest, if we had equal air entry on both sides. Equipment failure or stomach distension. We're going to be demonstrating how to place an LMA in an adult patient. So we've got someone here who's inadequately breathing, so we want to ventilate for them. So what we can do, we place the patient into the sniffing position, place a towel under their head. So we want to line up the ear with their shoulder. Get all my equipment ready, so I've got my suction here if the patient aspirates. I've got my LMA, OPA, bag valve mask, and Thomas tube holder. So first of all, I'll place this under here. So I'm already in place for when I place my LMA. And now I'm going to pop in an OPA so I can pre-oxygenate the patient first. So I'm going to bag valve mask, attached oxygen at 10 to 15 litres per minute. I want to pre-oxygenate the patient for 2 minutes at a breathing rate of every 6 to 8 seconds. So after 2 minutes, I will place in my LMA. Take that off. Take out my OPA. Get my LMA. So with the LMA, first of all you want to check the size. So I've got a size 4 here, and that's for a patient about 50 to 70 kgs. So first we'll check that the cuff inflates. So insert some air in there and make sure that the cuff is inflated, there's no air leaking. Yep, that's fine. Expel the air and lube up the LMA. Place it in the patient's mouth. Inflate the cuff. And I'll get the bag valve mask, and we want to check that we're getting chest rise and we've got adequate placement of the LMA. So place that on. Yep, and I can see chest rise, so that's good. Take that off, now we can place on our secure it by using the Thomas tube holder. Place that in the mouth, the bite block in the mouth. Tighten that up. Get our cross connector, place that on. Attach it on the bag very nice. So we want to ventilate every 6 to 8 seconds, like that. Say for example, if we weren't getting any chest rise and we wanted to troubleshoot the LMA, we could use the acronym DOPES. So that would stand for, say, if the LMA was dislodged, if we had an obstruction in the airway, if we had a pneumothorax, we could rule that out by listening to the chest, auscultating, see if we had equal air entry on each side. We could have an equipment failure or stomach distension. Alright, so in this OSCE I'm going to be demonstrating how to do an IM injection. So I have my patient here, and he's having an anaphylactic reaction. So I want to administer 0.5 milligrams adrenaline. So first I'm going to gain consent. Is it okay? I'm going to give you an injection here. This will help you. Is that okay?
Yes.
Okay, cool. Alright, so first I'm going to assemble all my equipment here. I've got my adrenaline, syringes, drawing up needle, and needle plus sharps container. So first I'm going to check the size of the needle I'm going to need. So I'm going to pinch the skin. I'm going to use the vastus lateralis site on the patient, which is lateral thigh. Pinch the skin, and I'm going to measure half of the skin for my needle size. So I'm going to use a 38mm needle. Got that there. Next I'm going to get my drug. So I'm going to do a drug check. I have adrenaline, 1 milligram and 1 mil. Expires on the 1st, 2013, so that's okay. I'd also get my partner to check the drug also. Now I'll also ask the patient, do you have any allergies, sir?
No.
No? Okay, cool. That's good. Alright, so we will first clean the site. With an alcohol swab. I'll get my syringe. Attach the drawing up needle, get my ampule, make sure there's no drug in the top, and break the top, take off the cap, and draw up the drug. Okay. So I need 0.5 mils. Here we go. Now I'm going to recap using one hand technique. Place my drawing up needle in the sharps container. Now I'll attach my needle. Okay, I'm telling the patient you're just going to feel a sharp prick. Take the cap off and use a Z-track technique. Pull the skin across the side. Then place the needle in, like so. Let go of the skin. And then I'm going to pull up first to make sure I haven't hit a blood vessel. So no, there's no blood. And then slowly administer the drug. I'm then going to cap my needle using one hand technique, take it off and put it in the sharps container. I also put my cracked ampule in the sharps container. And there we go. I will also document the time that the drug was given and also assess the patient for any further anaphylactic reaction.